Okay, we're pleased this evening as our presentation, our September presentation, to welcome Keighton Klos. I think if I have the title correct, you're the director of the Milton House. That's something I think that you really recently started back this February. And I know you've done a number of jobs with or other positions with the Rock County, I believe, Historical Society and things of that nature. So we're pleased to welcome Keighton this evening, talking about medical practices during the Civil War. So just give us a second here. I'm going to transfer ownership back to Keighton so she can do the presentation. Okay. I think I have you as being the host.
Yes, I see that. Okay, so before I start my presentation, just a couple of things. Number one, I am in a room that has motion sense lights. So if all of a sudden it goes dark and you see me waving my arms or I get up and walk around, it's because I'm trying to get the lights to come back on. So I'm going to kind of just try and wobble a little bit to keep the lights on. So I apologize for that. Also, as I go through, if you can't hear me, if someone could just speak up and say, speak louder. I'll try and stay as close to my microphone, but to get closer to my microphone, I have to get my face closer to my camera, and that's just uncomfortable for everybody. So just let me know if I need to speak up or slow down. And then kind of like was said, normally when I do these presentations, I really like to interact with all of you, and you can ask questions throughout and we can have a little more of dialogue. And with Zoom, it's just complicated to do that because of the lag and all of that. So it's going to be a little odd for me to give this presentation kind of all in one big dump and then talk to you guys at the end, but I will do my best. And then, so this is also only like my second or third Zoom presentation, so bear with me on that as well. So with that, I will attempt to share my screen and hopefully you're going to see the right thing. Give me 1 second here. All right. Okay. Can everybody see my screen?
Yep, we can see it.
Okay, perfect. All right, so kind of like what we talked about tonight, I'm going to be talking to you about death, dying, and the American Civil War. So not necessarily your feel-good topic of the night, or of the year probably, but it's a very interesting one. When I started to develop this back in actually end of last year for the Rock County Civil War Roundtable, I originally was going to talk about kind of Victorian death practices and mourning practices and why they are considered the cult of death, and that was going to be my original presentation. And as I started doing research, I kind of fell down the rabbit hole of the medical stuff, and it got to be really interesting. And so my whole presentation kind of pivoted to talk about why are the death and the casualty numbers from the Civil War so high, what's causing that, and then what was learned from that after the Civil War. So as many of you know, if you do any research, you often start with an idea of where you think your research is going to go, and when you're done, you're usually somewhere not anywhere near where you started. So this presentation is definitely, that happened to me. So I did want to just give a little introduction to myself since I'm not there to talk to you guys in person. I am the executive director at the Milton House here in Milton. So I don't know if you guys know the Milton House. We are the last, well, I should say the only authenticated Underground Railroad stop that you can still tour in Wisconsin. So we're pretty proud of that. We also have a tunnel that is authenticated as being part of how we moved freedom seekers while they were here in Milton. So I took this job in February of this year. So it's been an experience. For the past 5 years, I had been at the Rock County Historical Society in Janesville in a variety of roles. So I went to school. I have a bachelor's from University of Wisconsin-Whitewater in public history. I'm just a history nerd through and through. Abraham Lincoln is my guy. Civil War is, I read books, I watch documentaries in my free time. So it's really what I enjoy. So thank you guys so much for allowing me to talk to you tonight, and I hope you enjoy the presentation. So I do have notes in front of me as well, so if I'm looking down and stuff, I apologize. But there's a lot of information, so my brain's not going to remember all of it at one time. So with that, why don't we actually get into the meat of the presentation? All right, so first we're going to talk about kind of numbers and trying to give perspective to what was actually happening during the course of the Civil War when it relates to death and casualties. So to start out, just on your slide, you'll see Civil War statistics. And the first one at the very top is basically the total number of deaths during the Civil War, which is estimated between 650,000. I think the highest number I've seen is around 800,000. Depends on what sites you're looking at. And we'll talk a little bit about why, you know, there's basically $150,000 swing between those numbers and what's causing that. And then I highlighted a couple other things that I just wanted you guys to look at. You'll see about the third line down. It says the percentage of the American population that died during the Civil War, and that was 2.5%. And I don't know if you guys are anything like me, but I'm like, okay, 2.5%. I don't know what that means. So I like to have more hard numbers, and I think a good way to look at those numbers is what would that look like today? So if 2.5% of the population at the time was about 650,000 people, what would that look like today? And the answer to that would be that it would look like 7 million people if you took today's numbers. 7 million is a big number. 650,000 is a big number. It's hard to kind of comprehend what that is. So I'm going to switch the slide to give you a little bit of an idea to try and help you comprehend how impactful, how many people actually died during the Civil War. So you can see that in modern terms, 2.5% of the population, about 7 million men, which means you could fill Miller Park to capacity 167 times to get to 7 million people. A lot of us have been to Miller Park, I think. A lot of us have probably been there when it's sold out at capacity. And you think about that and all those seats, and then you multiply it 167 times. And that gets you an idea of what people are dealing with in the Civil War and the casualty rates. I mean, it's astronomical. If we had anywhere remotely close to those kind of numbers, any kind of conflict in modern day, I don't even know how people would react. I don't think they would know how to react. And they were unheard of in the Civil War times as well. I mean, the battle casualties in single battles and stuff like that are just crazy. So there's a lot of things that are making that happen. And in fact, it's not takes until the Vietnam War for the numbers from all other American wars to surpass the casualties from the Civil War. In fact, more Americans died as prisoners of war during the Civil War than they did during the entirety of Vietnam. So a lot of people are dying here. It's a very big number. I'm going to go back to my statistics really quick and just a couple other things I just want to point out as they relate to our presentation as we go through tonight. 2 out of 3 Civil War deaths that occurred due to disease rather than like a wound from a battle. So we see those casualty numbers, those death numbers, and we think, wow, man, those battles must have been horrific. And they were, but men were also dying who had never even seen a battlefield, or who got off the battlefield without any wounds. They're getting sick and they're dying that way as well. And then at the very bottom, I don't go into this very much, but this is actually a topic that now I'm kind of interested in looking into more. You can see that the ratio of African-American troops who died of disease was 9-to-1 to those that died on the battlefield. And it was largely due to discriminatory medical practices. So obviously, Southern soldiers had a reason to not treat Black soldiers well, but so did Northerners as well, and you can really see that in the numbers. So I do think that would be a really interesting thing to look into more for another presentation. All right, so let's move on a little bit from our statistics, and let's talk about casualties and deaths during the Civil War. One thing that's important to understand is that the term casualty and the term death are not interchangeable. They mean 2 different things. Death is obviously that you died. You're not going into battle anymore. You are really done. A casualty could mean a variety of things. Maybe you were wounded, maybe you got lost, maybe they don't know what happened to you, maybe you became a prisoner of war, maybe you were just unaccounted for at the end of a battle. And so the interesting thing about a casualty is that a soldier could be counted as a casualty multiple times. And how that would happen is maybe the battle gets done and you're going to do your muster roll to try and figure out who's there. And so you go through and you're missing some guys. They're not answering the roll. You can't find them. So you mark them as a casualty. But then later at a different muster roll, now they're back in there. Now they reappeared. Maybe they just took time to find their troops again, or their command again. And so your casualty numbers are kind of off the wall too, because guys are getting counted multiple times. Maybe they got wounded and then they were missing. And so casualty numbers could definitely be inflated. And again, I think today we use the term casualty a lot to mean death, and it does not mean the same thing. Also, during the Civil War, they only counted physical wounds or casualties. They're not looking at anything psychological. And obviously today we pay a lot more attention to the psychological impact of war on soldiers with PTSD and how they're handling it. And that's a lot of those guys, even if they're physically unharmed, if they have mental issues related to their battle experiences, they're considered a casualty. The Civil War is not taking any of that into account. Not to say that none of it existed, because there certainly are a lot of stories of men who did some crazy things after the war that you look at it now and you're like, oh yeah, they had PTSD. They were definitely had issues that they weren't dealing with. But none of those are counted in the casualty numbers as the Civil War counts them. And I think, and then the other thing I wanted to point out too, again, a lot of we talked about it on our slide too previously, but a lot of deaths are non-combat related. For every 3 soldiers killed in battle, 5 more would die of disease. So you have a lot of guys dying from things other than just being, shot on the battlefield. Okay, so statistics are important, but how accurate are they? Kind of mentioned casualty numbers can be inflated just due to a lot of different things that are happening in the course of a battle and trying to move your army after a battle and all of that. But also the records that we have are pretty unreliable, not intentionally, but they just are that way after so long. So main reason for inaccuracy is that the 3 type of primary sources that historians typically use to try and get these kind of numbers are little sheets of paper that were generated and compiled 150 years ago by human beings who were in one of the most stressful and confusing environments to ever exist. So we all think pretty straightforward until we're put into a life and death situation. We're thrown into chaos. And so to think that these guys are then going to be able to remember exactly what they're all supposed to be taking down, who they already counted, who was who, and all of that is just kind of crazy. And then they're just keeping it on these little pieces of paper. It's not like today where they could type it into a computer or they could just, talk into their phone and record it. They're going to have to handwrite all of that and then try and keep track of that. So just, how records were kept and who was keeping the records was definitely impacting it. Also, depending on the commander and the outcome of the battle, they might want to skew their casualties and death rates one way or the other. If they wanted it to look like they didn't get beat that bad, they might put their numbers down a little bit lower. They might inflate, other numbers to try and justify what was happening. So there is that, and that's kind of that human component of it. So the 3 types of things that are used are enlistment sheets. So obviously people needed to enlist to fight in the war, just like they have to do today. So they're set up, enlistment stations are set up around the country, in cities and towns, but most part they're in major northern cities. And that's where you have to kind of rely on those places to keep those records. And then Confederate enlistment rolls are virtually non-existent. So that's the other thing, is that you're trying to count these numbers for 2 separate armies. So you don't always have the best for both sides. Muster rolls are important as well. So that's generated every few months by a commanding officer. And it lists their soldiers as present or absent. Unfortunately, those little pieces of paper also had to be transported by mules or horses in the rear of an army. And so they were, preservation for them was difficult since they had to go through, rain, river crossings, clerical errors, cavalry raids, all kinds of stuff's going to happen to those pieces of paper. And again, just saying present or absent, that doesn't tell you very much beyond who was actually physically located there. And then the last one that is used is casualty lists. That gives the number of men in a unit who were killed, wounded, or went missing in an engagement. And however, combat threw armies into administrative chaos, and the accounting done in the hours and days immediately following a battle often raises as many questions as it answers. What exactly qualifies as a wound? Did armies account for them the same way? Like if you just got a little finger, maybe a cut on your finger or something like that, is that a casualty? Or do you have to, basically be going to the doctor to be considered a casualty? What became of the wounded soldiers? Were they a casualty because they were shot in the arm and then they ended up dying because of an amputation? So then now they're also a death. Did they rejoin their unit? Did they just go back home? Did they die? There's all kinds of answers that those muster rolls don't necessarily tell, except out of that one little snapshot. So as you can see, it's, historians have been trying for over 150 years to figure out these numbers. And so that's why you see anywhere from 650 to 850,000 men being killed or wounded during the Civil War. The numbers are just very difficult to actually pin down. And then the other one is you could make an argument, what if you were wounded in a battle and you survived, but then maybe 10 years later, that wound gave you complications and you died from that because of that wound? Do you count then as a fatality from that battle or not? So depending on how you're determining what was killing people could also inflate your numbers as well. And then, as we said before too, it's also not taking into account any psychological issues that any men are having. And there were certainly men who were committing crimes, committing suicide and stuff based on mental issues that they had after fighting in the Civil War. So we have some idea, but again, it's never going to be a perfect number and we're never going to know exactly. It's always going to be a pretty broad range. So that's kind of our base now. Let's talk a little bit about why this war, why are the numbers so high? Why are they so staggering? And in a way, why are they not that way in wars that happen after the Civil War? What makes the Civil War unique? So a few things we're going to cover. Battlefield tactics and weapons. I'm going to just talk about that briefly. And that's more just because that's what's putting a lot of men into medical tents and having to deal with doctors and stuff. So it's important to understand that. Then I'm going to talk about medical practices and how they were set up prior to the Civil War and how they were utilized throughout the war. I'm going to talk about infection, and then we're going to talk a little bit about disease as well. All right, so first let's start with some fun military tactics. Prior to the Civil War, Napoleon was definitely kind of the standard by which everybody who came after him was learning how to fight wars. So West Point, their curriculum was very much based on Napoleonic tactics. It had been used in wars before. It was used in the Mexican War. That was being fought by a lot of the soldiers who would eventually become commanders in the Union Army and the Confederate Army. And so it's what most people are familiar with at the time of the Civil War. Napoleonic tactics are characterized by intense drilling of the soldiers, speedy battlefield movement, combined arms assaults between infantry, cavalry, and artillery, relatively small numbers of cannon, short-range musket fire, and bayonet charges. So it sounds confusing. It sounds like you have to have a lot of pieces working all together at the right time, and it's dependent on the type of weapons that you have. So a few problems with that. The terrain in America is very different than where Napoleon was fighting. The wilderness is a great example of what Americans were dealing with in the Civil War versus Napoleon. Napoleon has big open fields. He's massing his armies and he's marching them across this field. They're able to stay together. They're able to see each other, see their commanders. Whereas during like the wilderness, when you're literally fighting in woods, you can't move forward in a straight formation because you're hitting all these obstacles. And so men are moving very piecemeal. They're getting lost. They can't see anybody. And so it's very hard to make complicated maneuvers when you can't see anybody that you're supposed to be using as your points of reference. And so that was definitely one issue. The big one, and most of you, since a lot of you are Civil War people, probably know this, is that weaponry had advanced. It advanced very rapidly during the Civil War, and the tactics were not advancing. The tactics were staying the same. And that was causing some pretty difficult situations for people. Primary infantry formation was a line of battle, and then it relied heavily on the bayonet. So basically, you get you guys in the line, and you just start marching them forward. And with bayonets, they were fixed. They go about 50 to 100 yards from the enemy, and they'd fire a volley, and then in the enemy ranks. And so what this did is massing your fighter power was because they were using smoothbore weapons. And so I do have an image of that, the one barrel that you can see that has no lines in it. So the accuracy of it was terrible. So the goal was basically you have one target, you get as many of these muskets shooting at that target, and you hope that at least a couple guys hit that target. So it was very important to mass your fighter power, because most of your firepower was kind of going off and not hitting what it was intended. So that line of formation and firing that volley was very important. However, by the start of the Civil War, and well into the Civil War, the weapons had made the linear tactics just obsolete. They were created when the best long arm was the flintlock smoothbore musket, with its 50 to 100 yard range, and the artillery was short range and inaccurate at best. The increased ranges of the new rifle, so then you see the other rifle that has the rifling in it, or the little grooves in it that would actually get the bullet to spin. That increased their firing range to 200 to 400 yards. And so people could shoot a lot farther and a lot more accurate with that weapon. And so in a way, it made that massing of your firepower that much more deadly, because now instead of shooting and having it go like this and you're hoping for a couple to go, almost all of it is going directly at its target. So now that target is in a lot more danger. Napoleon also assumed that it was going to be professional soldiers who were doing the fighting, so they would know all of their commands and their drills and all of that. So when the Civil War starts and it's a lot of civilians who have never had any kind of professional military training, even their commanders have never had professional military training, trying to get them to do these really complicated maneuvers with all of these commands just did not work well. They just didn't know how to do it, and they didn't have the time to learn it. And so battle plan was based on these complicated maneuvers, and right out of the gate, the maneuver would fail and everything would be in chaos, and there was no way to really regain what was kind of that momentum or that organization. So these tactics are still, you're still seeing frontal assaults at Gettysburg. Pickett's Charge is a perfect example of that. The Union Army is entrenched, and they got their guns out, and the Confederates line up in mass and walk across a huge open field. That's extremely Napoleonic tactics. So why, as late into 63 and 64, are they still using these tactics? It's because it's what they were taught. They definitely were adapting, but overall, most commanders still felt that what they had learned at West Point, what they had, been taught for a long time, that was the best way to go. And it was just taking them a long time to figure out the new weaponry and what kind of new tactics they could do. And then the other one, along with the rifled shotgun, is also the Manet ball, which has there's a picture of it on the screen as well, and that's the bullet style. This bullet was really interesting. You can see that it's got little grooves on it, and then it was actually a softer lead, so as the gun fired it, it actually kind of went out a little bit, and it got into those grooves, which caused the Manet bullet to really start to spin. And then the other thing about that is then when it would hit somebody, when it would hit its target, the bullet basically like flattened out. So when you see spent Manet bullets, they look like little round discs almost, because the bullet just kind of poof, because of that soft lead. So if you think about that, if something like that hits a bone like in your arm and then it just spreads out, it's gonna like shatter your bone. It's not gonna be a clean cut. And then also as it's expanding and it's going through your clothing, it's pulling pieces of clothing and stuff out of the air, and it's actually taking that and putting that right into that wound. So the Manet ball definitely changed what type of wounds the doctors were seeing on the battlefields. All right, so if you have a soldier who's out on the battlefield and they get harmed by one of these, what kind of medical treatment can they expect? Now, if we were together, I would ask you guys, when you hear Civil War medicine, what are some words that pop into your head? And I'm going to guess that most of them are not going to be warm, fuzzy words. They're going to be pain, amputation, death, lack of like a chloroform or something like that for people. Butchers, a lot of Civil War doctors are referred to as butchers. So that's definitely what we think of a lot when we have the American Civil War medical practices. And to an extent, I mean, it was true. Soldiers didn't want to go see the doctors. They were afraid of, what the doctor was going to do to them as well. But Civil War doctors actually get a pretty bad rap. They actually did pretty well with what they were working with. So we'll talk a little bit about that. Prior to the Civil War, to be a doctor, if you decided that you wanted to be a doctor, it was a fairly easy process. You didn't have any real hands-on clinical training. You were taught through a series of lectures. So you'd go 4 lectures each day, often clocking it at 8 hours total. The entire course, from admission to graduation, was 2 16-week semesters, one in the winter and second in the spring, without a shred of difference. What you learned in the winter was exactly what you learned in the spring. They just kind of reviewed it for you. Like, remember that we talked about it? Yeah, okay, that same material. So really, it's like 1 8-week session, and then you're good. There's no medical license issued. You don't even have to take an exam. You just show up for all the classes and you're good to go. Your best option of receiving hands-on training would be by being a doctor's apprentice, and calling on sick people, maybe helping to birth some babies, that kind of stuff. Maybe you'd set a bone, maybe you'd see a farming incident where someone got pretty maimed, but overall you're not really dealing with any kind of real trauma. You're dealing more with sickness and disease and kind of like birthing and that sort of stuff. If you wanted a more complete medical training, you had to go to Europe, which obviously that was not an option for the majority of people who were going to be a doctor. But you could go to the clinics and laboratories in Berlin, Vienna, Edinburgh, London, and especially Paris. And then additionally, military medical schools were established in several European cities to train doctors to treat war wounds and disease. At the start of the Civil War, there's about 55,000 physicians in the United States, and most were poorly trained, as we just talked about. There's no correct theories of disease and no adequate specific general therapies, except quinine for malaria, opiates for pain, and vaccination against smallpox. It was anyone's guess as to what was causing disease and what was physically happening inside the body. A favorite term that you hear when you look at medical stuff during the Civil War is heroic. It's called heroic treatment. So heroic therapy, you treated patients with bloodletting, so get rid of that bad blood, blistering, purging, and essentially treating symptoms with harsh, deadly compounds. And so it was basically, the theory was to affect an opposite of the disease state. Although by 1861, heroic dosing was in decline, dosing was they were using stuff like mercury, arsenic, and other deadly compounds, and it was still popular. And then heroic dosing was done basically, if you were really, really sick, they'd give you a lot of medicine. If you weren't really sick, they wouldn't give you as much. So it didn't matter your weight, your age, your size, anything like that. So someone who was maybe 120 pounds, if they were really, really sick, they'd be given a lot of medicine because they were really sick. And then maybe someone who was like 250 pounds, wasn't very sick, would get way less medicine. And so, as we all know, dosing is very important. And so some people were just literally, they were being killed by the amount of medicine that they were being given. Calomel was considered a miracle drug, and it was used for a variety of treatments ranging from syphilis and bronchitis to influenza and cancer, and it also acted as a laxative, and it was very popular. It was prescribed readily and in large doses by physicians of the day. And we'll come back to calomel and why that's important to know that one, but keep that one in mind when you're thinking about how doctors are administering stuff to their patients. Now, out of the 114 surgeons in the U.S. Army in January of 1861, only 114, 24 resigned to join the Confederacy, and they established the Confederate Medical Service. Few on either the North or the South sides were mentally or physically prepared for what was to come. Less than 1% of those 114 surgeons had any pre-war surgery experience. Military surgeons learned to amputate and performed a wide variety of procedures as they were actively engaged in conflicts. So basically, you set up your medical tent, the wounded start coming in, you realize that you have to amputate, and you just have to do it. You've never done it, you've never seen wounds like that. You maybe don't know if amputation is even the right call, but you have to make those calls in a situation that is incredibly stressful. So these guys are just dealing with a lot when this is happening. Also, how men were getting to the doctors was not set up very well. At the beginning of the war, it was required that for a regiment of 1,000 men to be mustered in, they needed at least one physician, one assistant surgeon, and a hospital steward. And a lot of times guys would just volunteer for those positions. Like, I work on a farm. I live on a farm. I've helped birth a few cows. I can be the doctor. I'll be the physician. And okay, great. We got 3 guys who are willing to take those jobs on, and you're good to go. Let's muster in and let's march off to war. So definitely not how we do it today. There's no established ambulance corps. Stretcher bearers were often expected to be the drummer boys who were 12, 14 years old. Put down your drum, pick up the stretcher, go find some wounded and bring them back. So I think this is sufficient to show how just unprepared people were for the scale of death that was going to happen. Imagine full-grown men who can't move or even are dead too on a stretcher, and you're expecting a couple 12-year-old boys to be able to just pick that stretcher up and walk it Lord knows how many miles through a battlefield. I mean, that doesn't even make sense in our heads, but that's kind of how they had it set up. And that can kind of go back to at the beginning of the war, people thought, this is going to be one battle, one and done. This is not going to be, like, hardly anyone's going to die. We don't really need to be prepared for death on any kind of scale because, both sides were bluffing and both sides were so much better than the other side. And so very reflective of that. So I find that very interesting. So first battle, first Bull Run, or Manassas, no organized ambulance system to remove the wounded or an organized medical treatment system to treat them. So soldiers lay on the battlefield for as long as 3 days. So you get injured in a battle and you're laying on a battlefield open to the elements for at least 3 days with horrendous kind of wounds. The largest military hospital at the beginning of the American Civil War had only 40 beds. By war's end, there were 204 Union General Hospitals totaling 136,000 beds. So again, beginning we had 40. And by the end, we had over 136,000 beds. One myth of Civil War medicine is that there was no anesthesia. That guys were just getting their legs cut off without having anything to help dull the pain except maybe a cloth in their mouth or maybe some whiskey if they had that. And it's actually not that true. And I found this really interesting, which is why I'm going to kind of go on a little tangent about it here. In over 30,000 documented cases of amputation, anesthesia was used 90% of the time. In the winter of 1846, general anesthesia using ether was developed, soon followed by the discovery of chloroform in 1847. Anesthesia allowed the patient a pain-free operation and the surgeon time to do a proper job. In pre-anesthetic days, a surgeon's competence was judged on his speed of operation, usually performed on an awake, struggling patient restrained by 4 to 6 attendants. Anesthesia freed the surgeon and opened the profession to those without nerves of steel. I think you still needed nerves of steel. That's just my opinion. Anesthesia use in the war totaled approximately 80,000 cases for the Union and 54,000 for the Confederates. It was actually apparently pretty safe with few deaths. Unfortunately, in the age when sterile stuff was unknown, operations of extended lengths increasingly led to deadly post-operative infections, and surgeons operated with dirty hands, going from one patient to the next without proper washing or cleaning instruments and dressings. Knives were often held in their mouth, and sutures were wet with saliva. The other interesting thing about chloroform, I think, so imagine if you're wounded and you're waiting your turn to see the doctor. Maybe it's your buddy next to you. He gets picked up and he gets taken to the doctor, and you can see him on the table, and they start doing something to him, and he starts really struggling, and then, you know, it's this whole big thing. There's all kinds of people around him, and then the next thing you know, he lost his leg. You might think like, wow, you know, they couldn't have used anesthesia because he was struggling and they had to hold him down. But apparently chloroform, when you're getting it put on, can make you feel like you're drowning. And so a lot of people struggled because they thought they were being drowned. And so that's where a lot of the struggle actually comes in. It's not from trying to get away from having your leg amputated, it's that you think you're drowning. And basically the biggest risk from chloroform is that you got too much. They basically just dosed you until you passed out. And so there's one gentleman by the name of Freeman McLivery. He was wounded in his right finger in 1864, and due to an infection, his finger needed to be amputated. While applying the chloroform, they gave him too much, and he never woke up. So a little wound on his finger ended up being the end of him because of the chloroform. But like I said, overall, it was actually fairly successful. It was more readily available than I think Hollywood likes to give it credit for sure. Now, infection. So if you did manage to survive maybe your amputation or your time at the doctor, the biggest thing was that maybe you're going to get an infection. No matter how slight the wound, once the skin was broken, the chances were good that bacteria would lead to drastic therapies, multiple operations, amputations, and frequently death. Hospitals were filled with patients slowly healing over months, and then a secondary infection would take hold, and these infections were particularly painful and deadly. Prior to Lister's landmark work, all wounds were expected to get infected, and the white creamy pus discharge called laudable pus was considered a sign of normal healing since ancient times. A secondary infection in the wound created discolored, often blood-tinged, watery discharge with a foul smell called malignant pus. Foreign matter left in a wound created the fertile source for pathogen bacteria to grow. Adding to the problem again, unwashed hands, dirty instruments and dressings, and went from infected patient to uninfected patient, spreading disease. There was definitely, to treat symptoms, doctors used morphine injections and anesthesia patients, which provided only temporary reprieve from the pain of the infections. Different infections of the wounds could gradually eat away at tissue, resulting in hugely swollen, painful, discolored limbs, which you can see in some of the pictures there. And then gangrene was definitely, and we hear that word a lot too, that someone got gangrene and passed away. Likely a combination of bacteria, streptococcus, and clostridia, but the exact cause was never isolated. But basically the tissue would die, blacken, and spread quickly, up to half an inch per hour or more, making hospital gangrene particularly evident to the patient. And your flesh kind of simply just melted away. And the mortality rate, if you got gangrene, was about 46%. And then, so that was definitely, again, that was a big problem, is that they thought things were healing, and then this other infection would take place, and it would go so rapidly, and they'd have no way to stop it. They don't know where it's coming from or how to prevent it. So it's definitely causing, infections were a big problem and a big factor in deaths during the Civil War. Disease was the other one. I have my picture from Gone with the Wind because I can't do a presentation and not have Gone with the Wind in there. But Scarlett's first husband goes off to war, and he actually never sees the battlefield, and he dies of a disease before he's ever actually in battle. Most Civil War doctors spent most of their time caring for the sick, not treating battle wounds. 600,000 deaths in the conflict, 400,000 died from disease. Civil War was fought 2 decades before germ theory of disease, and just a few years before Scottish surgeon Joseph Lister presented in 1867 his antiseptic principles of surgery and wound care. Also, if things are just not sanitary. So when they're digging, when they're setting up camp, you're supposed to dig your latrine 30 feet away from your camp. Every night, put a new layer of dirt over the day's refuse, and then, use it. But if you've been fighting a battle for 24, 36, 48 hours, and you finally get a time to lay down and sleep and set up camp, you really think you want to go dig a latrine? And if you're going to do that, do you really want to walk 30 feet away to dig it and then to use it every time? So a lot of times, they would just put the latrine right close to a stream, and it would contaminate the water for other people downstream, causing even more issues. Also, immunity was a huge problem. 48% of all Civil War soldiers came from rural areas and lacked exposure to many diseases that today are considered childhood diseases, such as whooping cough and the measles. So you have all these boys who are on the farm, they're not exposed to anything, and now you're crowding them into camps, you're crowding them into prisons with people from maybe the bigger cities, who some of those city boys have had some of these diseases, so they have a little bit more immunity, but they're also bringing some of those diseases. And, it's the same thing when Europeans first arrived in the New World too. I mean, Native Americans hadn't had any of the diseases, and it just decimates them. And it's the same thing that's happening during the Civil War. Sexually transmitted diseases were also a big problem, and that's a whole nother topic to talk about. But there's a reason that certain commanders, forbade guys from going into town, and that different stuff, because that was also a large problem that was killing people. And then this one surprised me as well. And again, if we were in person, I'd ask you guys, before I tell you the answer, what you think the #1 killer during the American Civil War was. And if you guessed diarrhea, you'd be right.
Wow.
It killed nearly 40,000 soldiers by the end of the war. And then malaria was the second most common disease, with over 1.3 million cases and more than 100,000 deaths. Typhoid fever was another one. And it was also sometimes called camp fever. And there were a lot of men that died of that. Pneumonia and tuberculosis are also ones that were high numbers, or killed men in high numbers. Civil War physicians labored with inadequate knowledge and therapies to deal with the largest number of diseased persons encountered in America in the 19th century. Smallpox vaccination, citrus fruits, and fresh vegetables for scurvy, and quinine for malaria were among the only specific and valid therapies they had available to them. Tens of thousands left military service with chronic intestinal and lung disease that killed them in the following decades. Okay, so all of that's really depressing. I don't know about you guys, but I'm not feeling too great right now. But there is kind of a silver lining, right? There's always got to be a silver lining. And that silver lining is what lessons were learned from this, what came from this. So since we started with battlefield tactics, let's briefly touch back on battlefield tactics. The next major war, at least that America is really involved in, will be World War I in the early 1900s. And towards the end of the Civil War, it was actually the soldiers who were kind of like, you know what, I'm not going across that field anymore. I'm going to dig some dirt up, and I'm going to hide behind it, and I'm going to use it to protect me. And so you can see a lot of earthworks on battlefields that happened later in the war. Kennesaw Mountain in Georgia, that was in 1864. That one, you can still see the earthworks are still there. It's a very cool battlefield. If you're ever in the area, I'd highly recommend going. But you see that more and more of the commanders are trying to fight a defensive side of a battle rather than being on the offensive. Men are digging trenches, they're getting their guys entrenched, and then trying to fight it out that way. Battlefield tactics learned during the Civil War greatly influenced how Americans fight in World War I. Heavy trench warfare, no more horses, still marching across some open fields, but only after using long-range artillery to try and soften up the enemy, similar to what they tried to do at Gettysburg. Americans were in a way advanced in their tactics in World War I compared to European armies, who had yet to learn the hard lessons learned by Americans during the Civil War. Weaponry continued to improve, and commanders were much more willing to adapt their fighting style to compensate for new weaponry than Civil War commanders were. World War I commanders had improved communication and transportation that allowed them to be able to be separated from their command and still command their troops, unlike in the Civil War. With the Civil War, obviously, you maybe have telegraph. Otherwise, you got guys riding on horses between commanders trying to communicate, which presents a lot of potential different issues. So again, Americans learned some really hard lessons during the Civil War, but then they take that into more modern warfare. And our military still is one of the best militaries in the world, the most advanced in tactics. And it kind of starts in the Civil War. We learn that we have to adapt, and we have to realize what's going on and adapt to that. And you can see that in World War II, between how Americans are fighting, even the Japanese are fighting. The Americans have that lesson, and the Japanese still don't. So we do get improvement on our battlefield tactics from that. Battlefield medical advances. So in 1862, William Hammond is named the 11th Surgeon General of the United States. He makes immediate and widespread changes. Okay, so here's some things that I kind of am like, really? He had to make sure people were doing this? He required that doctors track and chart what treatments they were using and if they were or were not working. He required that doctors be evaluated. And by 1863, there were just 3 experienced brigade-level surgeons operating at field hospitals, and only after consultation with each other. He set minimum requirements of age and skill for physicians in the Army Medical Corps and sent inspectors to examine hospitals for cleanliness and ventilation. The war provided a vast resource of unusual wounds, inspiring him to organize specialty hospitals, which became the basis for the establishment of medical specialties that we still have today. Hammond's creation of the Army Medical Museum and his directives for study and research on disease and wounds by pathological, microscopic, and photographic examination set American medicine on track for laboratory study of disease. The opportunity of treating, examining, and autopsying hundreds of thousands in the Civil War provided a basis for the emerging sciences. Hammond directly influenced the practice of medicine by dictating the removal of the deadly mercury compound calomel, that's where that's coming back in, and antimony-based tartar emetic from military usage. This did not make him a popular man. Remember how I said calomel was given out very readily? There were a lot of doctors. Hammond was only 33 years old. There's a lot of doctors who have been practicing medicine before Hammond was even born, and now this young gun's coming in and telling them that they can't use this medicine that they feel is one of the most versatile medicines in their arsenal, and they don't like that very much. So when he wanted it to be removed, a lot of the old school physicians were very much against it. And so that just ruffled the wrong feathers. And so he was actually let go because there was just so many people that were unhappy with him. So then there was a 38-year-old Dr. Jonathan Letterman, who was a graduate of Thomas Jefferson University in Philadelphia. And Thomas Jefferson University, is just kind of a fun fact, was co-founded by Dr. George McClellan, which that name might sound familiar. That was General George McClellan's father. So he went to the university where George McClellan's father was a co-founder. And so he actually, George McClellan's father was commanding the George McClellan was commanding the Union Army at the time of Dr. Letterman's appointment as chief medical director of the Army. And so General McClellan knew him and kind of gave him free rein to do whatever he wanted. So he kind of knew the guy at the top, so he got to do a little bit more than what Hammond did. So what does Letterman do? He establishes a uniform ambulance corps. Up until him, regulations stated that there would be 1 ambulance for every 1,000 men. He increases it to 2, and after Gettysburg, he increases it to 3. So 3 ambulances for every 1,000 men that are fighting. He introduces shocks on ambulances. So if you imagine you're wounded and then you're getting in a really hard wagon that has no shocks and you're being taken over bumps, you're going to be in a lot of extra pain because of that. He decides to train stretcher bearers. He called on volunteers to trade in their weapons for stretchers and learn how to drive ambulance teams. So now instead of having the drummer boys do it, you have guys who are specifically trained. And he trains them very specifically. Step together, beginning with the left foot to reduce jarring movements as much as you can. So it's stuff like that. I mean, down to really detailed stuff, very important things he's introducing. He also insisted on adopting a triage system. So what the triage system is basically, you have kind of people out front who, as the wounded start to come in, they start evaluating, okay, this guy just has a minor wound, he can set off to the side. this guy has a gut shot wound, there's no helping him, we're going to put him over here. And so that doctors aren't having to treat every single person, or they're treating people in a way that makes sense for their wounds. And so that triage system becomes very, very important to making sure that the doctors are not overwhelmed. He reorganizes military hospitals. Every military hospital have one surgeon in charge with 2 assistant surgeons, one to organize supplies and one to keep records. In addition to these 3 surgeons, hospitals would choose the 3 most skilled medical officers as opposed to the 3 highest ranking ones to operate. Letterman also made sure that the regular Army quartermaster was no longer in charge of medical supplies. Early in the war, if you were wounded on the battlefield, you had to go find your regiment's doctor for treatment. Treatment was on the regimental level, and he would make it, Letterman would put it on the divisional and corps level so everybody knew where their hospitals were. Field hospitals where the surgeons are, and as the men went forward in battle, they'd be followed by the assistant surgeon who would make forward aid stations nearest the front line. So that's the other thing, is now there's some medical help up towards the front. You don't have to get all the way to the back. At these forward aid stations, the assistant surgeon would make decisions about which wounded were not worth helping because their wounds were mortal, which wounded should be moved to the hospital for treatment, and which soldiers should be sent back to the front. Because there are definitely guys like that too, like, oh, that bullet grazed my shoulder, I better go, I'm really wounded. And he would say, nope, you're fine, go back to the front. So with quick and accurate triage, learning why and when to perform an amputation was paramount to treating the massive number of casualties. An amputation performed within 24 to 48 hours after injury was considered a primary amputation, and a secondary amputation was performed more than 3 days after the injury. It was soon recognized that primary amputations saved lives. Waiting to operate often resulted in a horribly infected wound. Clean white pus was expected in a normal healing wound. 4 deadly secondary infections were recognized. Hospital gangrene, and I'm not a doctor, so I'm really bad with these terms. Erysipelas, pneumonia, and tetanus were the other ones that were identified. So the medical and surgical history of the War of the Rebellion, or the Civil War, an extraordinary 6-volume work, summarized medical and surgical care in the war. It reports over 174,000 shot wounds of the extremities. 4,656 were treated by surgical excision, and 29,000 were amputated. Of the approximately 30,000 amputations performed in the Civil War, there was a 26.3% mortality rate. In the 1870s, so after the Civil War, Franco-Prussian War, despite the lessons learned in the Civil War and the development of antiseptic surgical principles, the mortality rate for amputations was 76%. So again, the Civil War had 26.3%, and in a later war, they had 76%. To stop the spread of infection, surgeons began burning the diseased tissue. And one of the great medical therapeutic achievements of the war was the discovery of halogen antiseptic solutions to treat deadly infections. Additionally, to prevent the spread of disease, isolation wards were established. Infected patients were issued their own sponges and dressings so that they would not be used patient to patient. The contagiousness of the conditions was understood, but the cause was not. The idea that invisible microorganisms were responsible was not easily grasped by many doctors until the mid-1880s. In retrospect, the surgeons of the Civil War did an outstanding job. As a result of the war, America gained hundreds of competent surgeons who would lay the foundations of modern surgical specialties. Letterman's plan still provides the basis for triage in modern emergency and military medical care today. So he was extremely impactful. In fact, Major General Paul Hawley, chief surgeon of the European theater in World War II, even had this to say about Dr. Letterman. I often wondered whether, had I been confronted with the primitive system which Letterman fell heir to at the beginning of the Civil War, I could have developed as good an organization as he did. I doubt it. There's not a day during World War II that I did not thank God for Jonathan Letterman. Care of the soldiers, I'll just go over this quick because I know we're kind of I'm pushing an hour here. But kind of similar, everything was just everybody was just so underprepared. There was no organization of trained nurses in the United States. The Crimean War 7 years before, and Florence Nightingale in England was the foundation for modern nursing concepts and trained nursing care. Women played a significant role in the Civil War. They served in a variety of capacities as trained professional nurses, giving direct medical care, as hospital administrators, or as attendants offering comfort. Although the exact number is not known, between 5,000 and 10,000 women offered their services. Dorothea Dix, who had dedicated her life to improving the conditions of people in prisons, poorhouses, and particularly mental institutions, volunteered for service. And on June 10th, 1861, she was appointed superintendent of female nurses of the Union Army by Secretary of War Simon Cameron. She was able to create a volunteer nurse corps and regulate supplies that were donated to the troops. She and her appointed nurses were given no military rank. The 60-year-old Dix was not trained in nursing, but had extraordinary organizational skills and was well acquainted with tackling resistant political and social forces. On July 24th, 1862, Circular Order Number 8 was issued, laying down Dix's strict requirements for appointment in her nurse corps. Candidates were to be between the ages of 35 and 50, obedient to rules, matronly persons of experience with good character and strong health. Compensation was 40 cents a day, and a 3-month minimum period of service was required. Mary Ann Ball, who was also known as Mother Bickerdike, went to war as a volunteer nurse and worked at the Sanitary Commission. She was described as a determined nurse who did not let anyone stand in ways of her duty. Her patients, the enlisted soldiers, referred to her as Mother Bickerdike because of her caring nature. When a surgeon questioned her authority to take some action, she replied, "On the authority of Lord God Almighty, have you anything that outranks that?" In reality, her authority came from her reputation with the Sanitary Commission and her popularity with the enlisted men. By the end of the war, with the help of the U.S. Sanitary Commission, she had built 300 hospitals and aided the wounded on 19 battlefields, including Shiloh and Sherman's March to the Sea. Mother Bickerdike was so loved by the Army that the soldiers would cheer when she appeared. At Sherman's request, she rode at the head of the corps in the Grand Review of Armies in Washington at the end of the war. My other favorite story about her is that someone was complaining to General Sherman about her, and Sherman simply replied, "She outranks me," so there's nothing he could do about it. Clarissa Barton, also known as the Little Lone Lady in Black Silk, an angel of the battlefield, worked on her own, separate from the relief and aid societies providing impartial care for Union and Confederate soldiers. Her work in establishing the American Red Cross earned her a distinguished place in medical history. Southern women also answered the call, primarily by helping with their individual states' needs, many on a personal basis, as only 4 Confederate states had formal relief agencies. 2 of the most notable women worked in Richmond, Virginia. One was Sally Louisa Tompkins, who opened a 22-bed hospital using mainly her own funds in a Richmond mansion. She may have been the only woman officially commissioned in the Confederate Army. And Phoebe Pember was a nurse and the female administrator of the Confederacy's largest medical facility, Chimborazo Hospital. So there's kind of your nurses and some of your women impact as well. So in conclusion, like I said, Abe Lincoln is my guy, so I can't not have him in a presentation. This is one of my favorite Lincoln quotes. We can complain because rose bushes have thorns, or we rejoice because thorn bushes have roses. Obviously, the Civil War was a terrible event and had a lasting impact on our country, but it also had positive impacts on our country as well. In retrospect, the surgeons in the Civil War did an outstanding job, as we kind of talked about earlier. And definitely, I think, as I have started to research this more and more, I have learned that a lot of the things I thought I knew about medical practice during the Civil War were misinformed. So I hope from this presentation tonight that you maybe learned a little fact or two. But most importantly, I hope that you gained a newfound understanding and respect for the men and women who fought in the Civil War, the women who helped heal those men and hold this country together, and the sacrifices that countless Americans, North and South, Black and white, male and female, made for this country, and how blessed we are to live in it. That's the end of my presentation.
Okay. Thank you, Keighton. We do have 1 or 2 questions in the chat box here, and the first one is from Jim. He says, "I understand that gunshot wounds were so deadly because the bullet calibers were large, causing extremity wounds that could only be treated by amputation." What are your thoughts on that?
Yeah, so definitely true. So I didn't talk about it in this presentation, but I've read a couple things about bullets and stuff. So like, yeah, so the bullet would when it hit a bone, it would expand and it would shatter the bone. And so you're right, there's no way to put that bone back together. So amputation was the only option. Also, that bullet is moving at a slow speed compared to what bullets are today. So bullets today move so fast that they actually sterilize while they're in the air because they get heated up so fast from how fast they're going. So when a bullet goes in, it actually sterilizes the wound as it enters. Civil War bullets were not doing that. They were actually expanding, taking smoke and debris from the air, debris from clothes, and pushing it into the wound. So it's almost starting an infection, right away from the beginning. So yes, it's very true. The bullets were causing, these damages to extremities and stuff, that amputation was the only option that surgeons had.
Okay. Yeah. Thank you.
Mhm.
I have a question. When you talked about like field hospitals, ambulance service, triage, things of that nature, is most of that your research coming from what I'd say Union Army documentation and practices, and how does that compare to what happened to the Confederate Army?
Yeah, the majority of the information I'm giving is definitely Union focused, and a lot of that is because we have more record of that and because they actually were doing that. The South, in a lot of a lot of ways, were not able to get prepared as well as what the Northern armies were. So even though there are surgeons who are resigning and going down to be in the Confederate military, into their surgeons, they don't have access to supplies like the Union armies do. And if they do have supplies, they don't have ways to get them to their armies. And so they were not able to, in a way, have the luxury of being able to design a program like what the Union Army is. So yes, this was mostly, a lot of what I got is Union focus, and a lot of that's just because there's just not much to talk about from a Southern side, whether the records aren't there or they just never really had anything that was different.
Right. Okay.
Did the Union surgeons help the Confederate soldiers?
Yeah, another question that just came up. In battle, if there was a wounded soldier, let's say it was like a Union hospital or area, did they treat both Union and Confederate soldiers, or was there some type of discrimination that would have gone on?
Well, Hippocratic Oath says that they're going to help whoever needs help, but there was definitely, I would say it was probably a case-by-case basis on the doctors or what type of situation they were in. Can't remember which nurse it was it maybe Clara Barton or whatever. She was kind of known because she would treat a soldier no matter what side he was on. So they're supposed to treat both sides, but definitely, certainly were instances where they would maybe give their primary surgeons to the Union soldiers. Maybe they would bring in Confederate soldiers last, or maybe if they only had a certain amount of room inside, that's where all the Union wounded would go, and all of the Confederate soldiers would be outside in the lawn or on porches. And on the flip side, in the South too, they would do that to the Unions too. There's a couple, I don't know them off the top of my head, but there are a couple instances where apparently, there's Union wounded and at a hospital, and then the Confederate Army, the battle line moves and the Confederate Army takes it, and they go through and they just bayonet all the guys that are laying there wounded. And then that's not even taking into account, black soldiers and what they're encountering if they're wounded, and depending on who they're found by. So I would say that they should, the politically correct answer is yes, they helped everybody no matter what. But I think that was not the reality very often.
Yeah. Another question that just came up kind of along these same lines is, do you have any information what happened to wounded black soldiers? Because you did make mention that a much higher incidence rate of disease and casualty and deaths among, like black troops as opposed to troops at large.
Besides that one statistic, I haven't looked into that more. I didn't go down that route for this particular presentation, but it's something that I'm definitely interested in looking more into. Obviously, the number of black men who are serving even in the Union Army is greatly lower than what the white population is. But it's, yeah, I don't know. I don't have any more information on that, but it's definitely something, I want to look into. If anyone has a good place to start on that, I would love to have that, if anyone knows any of that, but maybe that'll be another presentation sometime.
Okay. Another question. Have you read anything about Mary Sutter, a female surgeon in Washington, D.C.?
Not, but I might have to look her up now.
Yeah. Okay. Okay.
Well, and that's, that's the other thing too with women in the Civil War too, right? We all know that some of them were fighting. They were all doing a lot of stuff that they're not getting any credit for. There's no record of it, or it's word of mouth or that kind of stuff too. So women, trying to study women during the Civil War poses its own set of issues, because a lot of times the records are not, there are no records, or they're not official, stuff like that. But she sounds interesting for sure.
Yeah. And a couple notes, not really questions on the chat channel. It says Mother Bickerdike is buried in Galesburg, Illinois, and it's saying that her gravesite is worth visiting. And actually, we had a presentation at I believe it was a reenactment of Mother Bickerdike at one of our programs. It was a few years back, though, that we had this. So we're familiar with her. So okay. One more question. What was the youngest age that someone would be enlisted in the war?
Do you want the official answer, or do you? I mean,
we'll take both.
We'll take both. Okay. Well, with the Civil War, you got to look at Union versus Confederate, and then what time period during the war you're looking at. At the beginning, it was your standard 18 to 35. You had to be male, 18 to 35. Both sides, that's pretty much what they were going with. But there's so many issues with enlistment during the Civil War, of ways people got around that. Birth records were not great. You didn't go to a hospital, you didn't have a social security number as maybe written in your family Bible, so you could just walk up to a station and say, oh, I'm 18, and maybe you were 15, and they have no way of checking that. And they weren't really actively trying to check that. So at the start of the war, 18 to 35, but we know that there were boys, drummer boys and stuff like that, down to ages of like 10 and 12, especially in the Confederacy. And I don't know the numbers specifically off the top of my head, but I know the Confederacy for sure by the end of the war, they're pulling guys that are like 65. They're pulling boys that are like 10, because their numbers are just decimated. Right. So at that point, they're willing to take anybody. But the other thing I learned about enlistment, so then during the Civil War, you just went and said, yeah, I'm Joe Johnson and I'm 18 and I want to fight. And as long as you're in fairly good physical looking health, they go, okay, go for it. And they just send you off. And that's how a lot of women got into the armies, is because there was no physical examination when you were enlisted. Women would just dress in male clothes and yep, okay, you're a boy, go for it. And so a lot of women actually were able to get in because there was no examination. So that's why now, throughout history since then, that's why you have to drop your pants when you're when you're being enlisted, so that they can make sure that you're actually a boy and you're not a girl. And I thought that was hilarious that came basically out of the Civil War. So
okay, well, thank you.
Welcome.
Keighton, I'm going to give you one opportunity to put in a plug for the Milton House. Is there anything you want to say, kind of where you're at with it, with this pandemic, and how it's operating?
Sure. Yeah, we have been doing pretty well, all things considered. The biggest hit that we took is basically when Governor Evers said everyone had to shut down. It was about the same week that we were going to be starting our school tours. We usually have about 5,000 school kids come through, like in March, April, and May, and we lost all of those, and it's not looking good for next year either based on schools. We were able to open for the summer for tours, but in a limited capacity, but we still had a fairly busy summer. A lot of the racial tensions that are happening in our country right now are kind of bringing a more diverse group of people to us, which we really enjoyed seeing. And so we're trying to better tell that story. So for a long time, our focus was mostly on kind of the pioneer story. We talked about the good riches and the Underground Railroad, but we really talked about life in Milton. And last year we got a grant from the federal government to update our exhibits for the first time in 20 years, and to kind of pivot our focus more to an Underground Railroad focus. And so if you've been here before, you should come see us again, because things are definitely different. We're going to have some fun events happening this fall, a couple things in person, a couple things on Zoom. We have Facebook and a website. So if you haven't come down to see us, come see us. We're a pretty cool site. Like I said, we're very unique in Wisconsin in that we're the only authenticated railroad stop that you can still tour. And then we're actually unique in the country because we're the only authenticated underground portion of the Underground Railroad. So it's all right there, right here in your backyard in Wisconsin. So definitely come see us.
Okay, thank you.
Welcome.
Well, on behalf of the Madison History Roundtable, we want to thank you for sharing your time and your expertise with us this evening on the Civil War. And I want to let people know that we are recording this, and I will be putting together a video and posting it to our YouTube site. And that within the next couple of days, you should receive an email that has a link to that presentation or that recording. And I will also try to include the link to the Dolly Madison presentation as well from Jessica Mickna in that email. So again, thank you, Keighton, and have a great evening, okay?
Do I need to give host back to you?
No, I don't. You don't have to, I think. So.
No? Okay. All right.
Okay, you'll be the host forever now. So.
Okay. All right.
Okay. Bye, everybody. See you next
Thank
month.
you.